I'm the office manager for isometric muscle and body balancing, and my wife is a practitioner, and her client is Cathleen Stolp. Stolp, yes, okay. So we'd like to ask you a few questions in an interview. And first of all, how did you find out about Jill?
My daughter-in-law, when I came down to Florida, told me that, I know a lady that might be able to help your back and hip issues. She was recommended to me as being the miracle worker because I was having knee problems. And after a couple of treatments, I realized I didn't have knee problems anymore.
Okay. Well, that was wonderful. What were some health issues that you were having?
I've had some long-standing health issues, some of them going back possibly 10 years or more from when I was driving truck long haul. And the hip was bothering me then in the lower back. But also about 3 years ago, I was doing some gardening, and it really caused both hips and lower back to flare up. And also I've had some middle back issues also that sometimes puts me on the bed for a while.
Okay, so actually you were kind of probably a little bit in trouble there for a while, some ongoing pain, considered really a long-term problem. So what was the difference compared to things that you were doing before and then what you did with Jill?
I had gone to physical therapists in Washington State 3 different times. One time they told me there's nothing more I can do for you. And so I had almost kind of given up on being helped that way, even though I hoped that would be the way that I could be helped, and had actually gone to a clinic and had injections in both hips. And yeah, that helped for like 2 or 3 weeks, but that isn't going to be a long-term solution to a problem that's been going on for all this time. And I've gone to massage therapists, I've gone to chiropractors. Nobody did the method that Jill does.
Okay, yes, it's pretty much quite extensive of what goes on in trying to help people. So how would you say that isometric muscle and body balance helped you?
Immediately, it didn't make it feel a lot better, but it definitely made it start to feel different. So I knew things were changing, and I knew that after having had problems like this for that many years, it wasn't going to be an immediate quick fix because as she explained, we've got to get things back in alignment and back in balance. Mm-hmm. And when they've been out for that long, that's the only thing they know anymore. Mm-hmm. And so after 4 or 5 treatments, I could definitely start to tell that things were getting a lot better. And as we have progressed, like after last treatment, like I told you, I was ready to go out and fly because it felt better than it had for years.
Okay. So really, that's absolutely wonderful, and it's good in the thought that you were actually discerning to realize it was a long-term problem. It wasn't going to be done absolutely overnight. So there were multiple treatments that were involved. How many treatments would you say were involved so far?
Oh my, I don't remember for sure. I know I had to go back home to Washington State in February for a birthday party for my mother-in-law who turned 95. And so before I left, I was getting at least 2 treatments a week from Jill to try to do as much as I could. And so I would say that probably 9 or 10 treatments maybe total before I went home.
Okay, very good. So would you recommend isometric muscle and body balancing to others?
I most certainly would, because everybody that I've talked to that has tried it has been helped tremendously, and I myself feel like I can now keep up with those 4 grandkids that are under 9 years old.
Okay, so it's kind of life-changing, so that's a wonderful thing. Well, thank you, Kathleen, for your interview.
And it's a healthy fix.
Okay, absolutely.